for a fireside chat on mitigating methane.
Welcome back. Welcome, Sarah. Welcome to my home. No, it's wonderful. And Sarah and I have had the pleasure of doing panels before, and we were joking when I found out I was doing this one. I said, "Oh, you got me. This is a topic I think I know about, but I'm actually not that sure." And it turns out I didn't know nearly enough. So, if you would, Sarah, let's just set the stage, because we're talking about methane, and I think many of you may be in the same position that you think about it, or at least in terms of one thing. So, what do we need to understand about this problem and the scope of it?
Yes. So let's just start with the basics. What's methane? Where is it coming from? How it impacts health.
Yes.
Maybe I'll just lay that out in 3 parts. So methane is referred to these days as a super pollutant. It can trap 80 times more heat in the atmosphere than carbon dioxide in the first 20 years that it's released. So estimates now look at potentially 30% of the human-caused warming that we're experiencing right now is attributable to methane. And the other interesting thing about methane is that it doesn't last in the environment as long as carbon dioxide. So it had been called a short-lived climate pollutant, but that's kind of a mouthful. So there's been a lot of effort to say that we need to cut methane now as we decarbonize, because it could be one of the fastest, most efficient ways to slow the warming we're seeing right now. So methane comes from really 3 big sources. Agriculture, that represents roughly around 40%, largely from livestock. So think about cows and other ruminants burping up their food that they've digested. And some from rice, oil and gas, which represents about 1/4, and then waste. Largely landfills, but also wastewater. So maybe just then, okay, health. Should I go to health, or do you want to?
So I think, that I think is where my knowledge was. I know that it contributes to climate, but I wasn't aware of the health. Right. That's the bit that I was not as aware of. So what is the impact on health?
Yeah, and part of the reason I wanted to talk about this, or excited to talk about this, is it's really the theme that everyone's been discussing today, which is we need to take a One Health, or an integrated approach, as we think about climate, both mitigation and resilience. So there's sort of 2 pathways we think about it. One is the warming that we're seeing, right? And many people have talked today about the impacts of that warming on health, from extreme weather events to shifting infectious disease. We heard a lot about that, to deteriorating water quality and air quality. So there's that aspect, but then there's the more direct pathway when you think about those human activities related to methane emissions. So think about the oil and gas sector. When a well is drilled, when production of oil and gas through pipelines is created, it's not just methane. You get a lot of co-pollution associated. So a couple different things are going on. You've got methane, which is being released in the air. It can help form ozone, and this is not the ozone that's way up in space protecting us, but tropospheric ozone. This is ozone that we're breathing. That ozone can irritate our lungs. It can cause asthma attack, cardiovascular events, stroke. This is well-founded, scientific evidence of this. So you've got ozone, methane contributing to ozone, and then those other pollutants. Some of them are highly hazardous that can also contribute to ozone, but actually can, if they're breathed in, represent real health risks to communities that live adjacent to those activities. And there's a lot of communities around the world that live very close, in the case of oil and gas, to those wells.
So really raising the urgency to try to address this, I think, from all fronts. So what can be done? Is this a problem that is easily solvable? I know the answer is no, but what can be done in the short term?
Yes.
What practical?
Yes. Well, I mean, what's been exciting about methane, and many of you may have been following, is there's just been a wave of energy and commitment to cut emissions. You've got commitments from, over close to 160 countries around the world committing to the global methane pledge. You've got countries that are setting up new regulations around methane. You have a new commitment among dairy producers led by Danone to cut their methane emissions. You have national oil and gas companies coming together at the last COP, again, to voluntarily, cut methane emissions. And in the oil and gas sector, some of those solutions are very readily available. I mean, it's preventing leaks, flaring, so stopping that emission from happening in the activity itself. For landfills, it's a more complicated picture. It's capturing that methane, but also, addressing all the other co-pollution that often comes with particularly poorly regulated landfills, which are a huge problem all around the world.
It sounds like the technologies, the answers
Exactly.
are there. So what's the rub? Where's the barrier?
Right. Well, so and part of why I've been so adamant about talking about the co-benefits is we have all these commitments. We now have a lot of data looking at methane, and more to come. My organization helped launch a new satellite called Methane Sat that is now orbiting and is starting to produce data on methane. There's these commitments, okay, but emissions are going up. Oil and gas production and oil and gas exports in the United States are going up. If we're here talking about the United States because we're sitting here, the name of the game right now is accountability. And so, for example, we've done a lot of work in the Front Range of Colorado. Colorado's been a leader in trying to manage methane pollution and the co-pollutants that have been impacting people. It's a very densely populated region. They're still seeing expansion, right? They're tracking the data. They are trying to consider the health impacts, but the pressure to produce is still there. So if we're going to turn this around, we really need to expand the number of people and the sectors that are engaged in something that I think has too narrowly been just defined as this is a climate issue. This is an enormous health issue for the millions and millions of people in the case of oil and gas that live adjacent to these
So is there
wells.
opportunity there?
Yeah, I mean, I think there's enormous opportunity. Our approach has been, for example, in Mexico, again, Mexico has been a leader in this space, but production's going up. We've been bringing communities who are living at the fence line, but also the public health agencies, to talk about how do we amplify the pressure on both the producers and the government to drive that accountability. Because they're going to start being, held accountable for the commitments that they've made. But where is the political resistance in that? And so bringing in people from the health community to talk about what it means to live next to this pollution and then put quantifiable numbers behind it. So we did a national assessment of oil and gas on the public's health in the United States and estimated a whopping $77 billion in annualized healthcare costs. That's due to asthma attacks and premature death. Now that's, it's hard to prevent all of that, but that is actually making real the impact of these activities.
Well, it's an incentive, isn't it? It's
Right.
an incentive to force action because you'll have the cost savings. I imagine there's also potential, if consumers are educated, for political fallout if something's not done.
I think that's right.
But
Because
maybe we're not aware of how exposed we are. Is
Well,
this where
and-
data can play
yeah,
an important...
I think it does. And what we did in that national assessment is you could actually look at the impacts of oil and gas in an oil and gas producing state on the people in a state that aren't producing oil and gas, right? Because air pollution crosses boundaries. And so it can just make those externalities of, in this case, oil and gas production much more real, I think, to people in their everyday lives. And quite frankly, you can focus it on political actors in that space. So it's one more tool in the accountability. It's not the only tool. We're doing a lot of work in this space at EDF to hold those companies and countries accountable, including the Methane Sat. But it's about expanding the pie and looking at the problem holistically.
So as we exit this conversation, what message would you like everyone to take away?
I think that it's, let's think about how we can amplify some of these commitments around climate and greenhouse gas emissions and put those health impacts to it, because I think it changes the conversation. It brings new people in. The cost is always going to be high. And
the cost of treating people who are dying is very high, too.
Yeah, exactly. And so it's part of this larger discussion on the nexus of climate and health, which has been so exciting to see happen here at FB.
And something that's echoed, I think, in all the conversations that I've been in this week is trying to break down the silos, get at the problem earlier, and from a more holistic point of view. If you have many shareholders that are engaged, then you're sharing the burden, especially when it comes to capital, I think, which is so important.
Yeah, that's great.
Sarah, it was so great to see you again.
So good to see you again.
Thanks, everyone.
Thank you, Maggie.